Hi, I'm Kirsten with Four Paws Veterinary Wellness, and today we're going to give a demonstration on giving a vitamin B12 injection to a cat. So the first thing you want to do is have all your supplies ready. You're going to have your injection, and you're going to have your syringe. An injection to a cat, so we're going to be giving 0.25 mils or cc's of vitamin B. So we're going to be using a 1 ml or 1 cc syringe, which is shown here. The way that you get your syringe is you open up the plastic packaging by pulling back and exposing your syringe. You're going to look at your syringe and just push together the syringe with the needle just to tighten it so that it doesn't come apart when you're giving the injection. To remove the cap from your needle, which is here, you're going to pull straight and expose your needle. And here's your needle. We're then going to take the needle and we're going to put it in the middle of your plunger and your injection, like so. And then we're going to turn the bottle upside down. By turning the bottle upside down, this allows the liquid to come to the bottom of the bottle so that you can access it with your syringe. Now we're going to be giving 0.25 mils of this vitamin B. So we're going to get that into the syringe by pulling on the plunger here with your hand and your finger. And you can see the red liquid is the vitamin B. I'm going to pull past the 0.25 so that I can remove these tiny bubbles. These tiny bubbles are just a nuisance, so we want to remove them because it decreases the amount of measurement in our syringe. They won't hurt your pet. So the way that I do that is I hold the bottle like this, the syringe on my hand, tap the syringe gently to get the bubbles to rise to the top, and then I push the plunger towards the bottle to push the liquid back in. So now I have the vitamin B liquid all the way to the 0.25 mils. So I'm going to remove it from my bottle, set my bottle down. I'm going to take my syringe cap and I'm going to very carefully recap the needle. This is one way to do it. The other way to do it would be to set it down on the counter and to push the needle in, tip it up, and push down. And this is the way that you can avoid poking yourself. So I want to put a new needle onto my syringe so that when I give this to my pet, it has a new needle on it, and that's sheerly for comfort purposes for the pet. So this is what one needle would look like. This is what another needle would look like, and these are the same needle, just in different packaging. So for this one, you're going to open it up like this and have your needle. If you have the needle that's all in plastic, you're just going to turn to break the seal. This is garbage, and here's your needle. So to remove this, we're going to give it a slight turn, and that separates the two. Now, there's no threads on either the syringe or the needle. It's just the turning breaks the seal that is formed there when it's sterilized. And we're going to set this aside for disposal later. And we're going to attach the new needle onto the syringe. And we're also going to push hard for this one. So that way when I pull the cap off, only the cap is off and the needle stays on the syringe. If by chance you don't put this on tight enough and you go to pull it off, your needle will come right off, which is not a problem. Just push it back in, push, maybe give it a little turn, and then try it again. This is my cat Neo, and for demonstration purposes we're going to use him. He does get vitamin B injections on a regular basis. So to do that, we're going to describe where you're going to give the injection first. So this area is called the scruff, over the shoulder blades of a cat or even a dog, and this applies for both cats and dogs, all of these demonstrations. I am right-handed, so I'm going to hold the syringe in my right hand, and I'm going to use these 3 fingers to make a tent so that I can give the injection under Neo's skin in the scruff area. So again, these 3 fingers, I'm going to take his skin, I'm going to give it a slight pinch, and I'm going to pull up in the same time. The injection is going to go under his skin in the subcutaneous layer of him, and so we're going to take the syringe and we're going to put it in here in this pocket, and then we're going to push on the plunger to give the injection to him. So I'm going to take the cap off of my needle. I'm going to tent Neoskin. I'm going to hold the syringe like a dart. I'm going to gently insert at a 45-degree angle the needle under his skin until I feel a slight popping sensation. Then I'm going to take my index finger and I'm going to push on the plunger until all of the injection has gone under his skin, and I'm going to remove the syringe like so. Then I like to brush over their fur like that so I can make sure that I didn't give the injection on his fur and it did go under his skin. Now when you do that, if the injection did go under his fur, then give the office a call to find out if you should then administer another dose or if you should hold off. To recap the syringe, I'm going to push it in the cap, tip it up, and push down until I feel a click, and that will put the cap back on the syringe. Then you can disassemble the syringe by taking and twisting off the needle and leaving the syringe here, and the needle part is going to be put into a sharps container or into a safe area where we can dispose of that, and the syringe can go in your trash. And that is how you give a subcutaneous injection.